Zimbabwe recently experienced a devastating second wave of the COVID-19 pandemic, with more than 20,000 cases in the first 5 weeks of the year. And for a country with a crippled and dysfunctional health system, the majority of the country's poor citizenry were forced to turn to traditional herbal remedies and medicinal plants in fighting the pandemic. Although now a scientific study has been conducted on the effectiveness of these remedies, results on the ground are encouraging. Zimbabwe now has 34,000 cases and over 1,300 people who have died from COVID-19. Noma, Bolani and Ephert Musekiwa compiled this report.
No medicine kills this virus. So that's other misconception that there will be a vaccine, there will be a medicine. No medicine kills this virus. What is important is to debilitate it.
A grim reality for many in Zimbabwe. Faced with the raging pandemic and a near non-functional healthcare system, citizens are turning to medicinal plants that they've known for years.
It is until recently when we found ourselves stranded as a country waiting for a vaccine out there from the well-established populations to bring us a vaccine, where people were waiting and not knowing what to do. Hence resorted to this plant for use. Having known this plant to be used for chest-related illnesses effectively, so people started to hunt for this plant again and to test, to try and use it and mitigate the progression of the COVID-19 and many of the things that followed with the COVID-19. Fevers were going down when people were drinking this.
Zumbani, or umsuzwana, commonly known as the fever tea tree, is a woody perennial herb with strong aromatic-like fragrance. The plant grows naturally in Central, Eastern and Southern Africa. Local scientists are already excited by the initial results of their studies.
This plant is very high and very rich in phenolic compounds, very rich in antioxidant efficacy, and we also then tested for its potential to be mutagenic, and also tested for its potential toxicity on the liver cells and also on the kidney cells. What we then discovered was that when you put like 10 times as much of Zumbani tea quantity that a normal person can drink, there was no effect on the liver cells. The liver cells were not damaged.
There's a strong belief that Zumbani plant health benefits are largely the reason many in the country have not only been able to protect themselves, but manage the symptoms of the respiratory disease.
I'm telling you, Zumbani is helping so much, you have no idea. You know, on a personal note, I have been packaging Zumbani myself for the last 20 years and selling it, but the demand was never big. I even have relatives who think that this is coming from the devil. It smells like the devil. All of a sudden, everyone is looking for it. And I'm thinking, my goodness, I couldn't do it. I couldn't tell my fellow Africans that there's so much good in a lot of the herbs that we have. As a matter of fact, there's so much we just don't know. You just walk in the garden here or out in the forest, every other plant is suitable to help you to have prophylactic kind of benefits from potential diseases, but we don't know anymore and we don't know them. So in the case of Zumbani, what it has done is, for those who take it regularly, don't wait until you catch COVID and then you start drinking Zumbani. It's like trying to go to the gym the moment that you start falling ill. You go to the gym so that you stay healthy. So you drink Zumbani and similar herbals so that your system already is ready to tackle especially viruses. But usually some of these, like Zumbani, don't only attack viruses, but they're also antibacterial and antifungal.
So far, people here in Zimbabwe there have been positive claims about this plant, having worked for them when they were COVID-19 positive. And then some have been claiming that, it didn't work so much for me. But it's something that has raised our eyes to try and work on it. Clinicians, both herbal scientists, biochemists, medical doctors, pharmacists, toxicologists, everyone can now come and spend more time on this plant and test, vindicate the claims that have been made by the people in the community.
Meanwhile, some have found an opportunity for enterprise.
People are really liking this Zumbani and are buying it a lot. I get my Zumbani from Bindura and I sell it for $2 a shrub. Currently, it is difficult to meet the high demand, but this plant is really helping a lot of people.
Zimbabwe's health minister and vice president, Constantino Chiwenga, recently noted the increased use of traditional remedies in the fight against the pandemic. He says natural plants and herbs need further scientific research to prove their benefits. But with confusion on whether the vaccines will be administered for free or be paid for, many are relying on this wonder herb. Noma, Bolani, SABC News.
Well, we are now joined by Professor Mandi Rukuni, who is a traditional herbalist, and a bit later on we'll be in conversation with Dr. Michael Bhebhe as well, who is a scientist. Professor, good evening and welcome to the show.
Thank you for having me. I'm actually not a traditional herbalist, but I'm quite happy to talk about it.
Thank you so much, Prof. Really appreciate your time. Also, Dr. Michael Bhebhe is now part of the conversation. Really appreciate your time as well.
Thank you very much, sir. Thank you for having me.
Thank you
so much,
everyone. Thank you so much. Prof, let's start off with you. What is Zumbani?
Zumbani is a herb that is actually found widely throughout our region: South Africa, Zimbabwe, Zambia, Botswana. It's been around and used for centuries, actually. So even when the whites started colonizing us and staying in here, they were using this herb as the English actually called it a fever tea. I know the Afrikaners had a name for it, but all the African linguistic groups in Southern Africa know it and have used it for a very long time.
Mm-hmm. For what purposes has it been used historically as well?
By historical, you mean just in terms of it being passed for generations and generations, well before we even had a Western type of medicines. Yes, it's been around for a very long time.
Sure.
And you know, the beauty with Zumbani is that not only has it had these kind of medicinal qualities, preventative qualities that have been proven over time, but it can also be consumed, you know, just as a normal tea. It's something that has been very easy to become a lifestyle of Africans.
Mm-hmm. And I was actually listening to an interview with one of my colleagues on a radio station, but they were having a conversation more about rooibos tea. And when I was doing some research on Zumbani, seeing that it also too is high on antioxidants.
Very high on antioxidants. As a matter of fact, Zumbani will trounce rooibos in so many departments, you can't believe it. There are a number of scientific papers by pharmacologists and others who have tested and looked at the active ingredients in both Zumbani and rooibos. And as you say, from flavonoids to various types of active ingredients. Actually, Zumbani is got almost active ingredients. Again, it's actually antifungal as well, besides being antiviral, antibacterial, and it is also antiplasmodial. So malarias and stuff like that is also quite active.
Okay.
So it is a little bit of a universal kind of antidote when it comes to some of these chest.
I was about to say that here back home we speak about Izifo zonke, so I wonder whether this could be something like that as well.
That's the one. That's the one. When you're not sure what it is, go for Zumbani.
Dr. Bhebhe, what is it about the properties that are in the leaf of this tree that makes it a miracle, as some may argue even?
I thank you very much for the opportunity. Thank you, Prof. Rukuni, for the feedback. I like your presentation about antioxidants. Zumbani is very high in phenolic compounds and antioxidants. Just to answer your question, though, Zumbani has got chemicals that are specifically usually target microorganisms that affect the chest, which is why most Zimbabweans this end have been rallying for it and trying to use it as much as they can.
So when you speak about the chest, what exactly is it that it attacks in the chest?
Well, I could give one example, Klebsiella pneumoniae, bacterium that usually affects, once it affects the chest, it can lead to pneumonia. It has been tested against that plant, that microorganism, and it's been found that when you extract some compounds from Zumbani, they can kill that bacterium. I can confirm even tuberculosis. There have been some studies against the mycobacterium for tuberculosis, and it was tested that there is more than 50 to 60% efficacy of Zumbani extracts against that. So already we know by now that tuberculosis is a chest-related infection.
Okay, Dr. Bhebhe, are you still there? Dr. Bhebhe, are you still there?
Hello?
Okay, we
Yes,
seem to have lost you just there towards the end as you were concluding.
Oh, yes, I was saying, as we know that tuberculosis is a chest-related infection, so mycobacterium is killed by Zumbani extracts. There's some publications on that so far. So which is what makes Zumbani a sort of a miracle herb, so to say.
So Professor Mandi, for instance, speaks about how Zumbani would trump rooibos tea. Would you have the same argument, Dr. Bhebhe, when it comes to mhlonyane?
Well, I know for one, from the paper that we published in 2015, we tested for antioxidant activity of Zumbani extracts, among other indigenous teas that we find here in Zimbabwe. Zumbani had higher phenolic content and higher antioxidant activity than some of the rooibos teas that we picked from the shelves this end. But I wouldn't know. It would be interesting to test both of them and see which one works better. I haven't read any work that has been comparing the two. I would love to participate with scientists from South Africa so that we can compare and see which will be the best way forward, because the way forward nowadays is not to work in silos. I've come from Midland State University and we are researching on herbal medicine. If we have scientists in South Africa who are working on these plants, it will be good to combine together and then research on the plants,
okay,
on the products together.
Professor Rukuni, do you find that there is perhaps a level of mistrust or between what we call Western scientists and our traditional leaders as well, or healers, when it comes to medicine and the type of medicine?
Oh, yeah, I mean, you're just being nice because you're a nice guy. We are heavily the colonial trauma that we still experience 100 years after colonization is just enormous.
Get you on a different line. Unfortunately, there seems to be a problem with the line. Can we just quickly sort that out with Professor Rukuni while we try to re-establish that line? Let me pose that question to Dr. Bhebhe. Dr. Bhebhe, your take on that question that I just asked.
On the mistrust with, please come again with your question.
So the level is there a level of mistrust between the traditional healers as well as what we call Western doctors because of what we'd argue would be medicine that comes from the West, and people say that trust this particular medicine instead of the medicine that comes from traditional healers?
I think it has been an ongoing trend that conventional medicine that we usually have and the herbal medicine that is used by most of us this end is they don't really usually go hand in hand. But I long to see a time when we do just like how they do it in India. I know in India they have a full medicine program where you learn how to cure, how to heal someone who's struggling with an ailment and be healed and be treated with herbal medicine. And if they realize that you can't be healed properly, if they notice that you can't be healed properly with the traditional medicine, you can then go on to use conventional medicine. One thing I've noted in my studies as a scientist, there are certain instances where you have a pure extract from a plant, which we might find as a bioactive compound, and then you test it against bacteria, and then you find out that it doesn't necessarily, it's not as potent as it was when it was still inside the plant. So sometimes pure compounds extracted and made into drugs may not be as efficacious, if there's a word like that. They may not be as effective as they should, unless if they are inside a plant and they work in synergy. So I think it's about time that we came together and tried to work as one team and fight against the ailments that are attacking our human race.
Sure. And as we conclude the conversation, Dr. Bhebhe, as well, just another reiteration that when we speak about Zumbani, we're not necessarily saying that this is a cure for COVID-19. However, what is it?
Indeed. Zumbani is a nutraceutical. Zumbani is both food and medicine. Like what Professor Rukuni had said earlier on, it's been consumed in Africa for ages. So people have been consuming it as food for ages. And when they have problems, they usually go to it because they've seen that this plant can particularly assist them when they have certain conditions. I can bet when someone has a sore throat, Zumbani has the properties to reduce the sore throat. When someone has a fever, someone can take Zumbani and then all that goes away. So it's also rich in minerals. Zinc is one of them. There are certain amino acids. So already, if you consume it daily, you consume it just like rooibos. You can find it. It's got medicinal properties. It's got also nutritional properties. So Zumbani for us, I would categorize it as a nutraceutical for now.
Okay, let's quickly try the Prof again. Prof, if you can hear us, if you want to attempt again the question that I asked earlier on. Hi, Prof, if you can hear me, the question that we asked earlier on. Okay, we seem to be struggling with that line, but totally appreciate your time. That is Professor Rukuni as well as Dr. Bhebhe. They're joining us for a conversation around Zumbani. This is the wrap of the show, but before we wrap up, here is an update. The World Health Organization's expert group on immunization, SAGE, has recommended the use of AstraZeneca vaccines in settings where variants of coronavirus are circulating. This comes after South Africa halted its rollout of the drug due to a small-scale study that found it had a far lower efficacy against mild and moderate diseases caused by the 501Y.V2 variant. The panel found no reason not to use the vaccine.
The advice from SAGE and taken on board now by WHO is to proceed with the vaccine even in the setting of variants, with countries taking into consideration their own specific epidemiologic situation, the access that they have to a variety of different products, and to tailor that decision-making for each country. The intention, as we understand it from South Africa, is to proceed with the use of the AstraZeneca vaccine in the context